So tables are turned. I am actually at the dental office for a little field trip today because I have a tiny little imperfection, like a mere blemish of sorts in my enamel. And so I am here at the place that I worked for, like 18 years to get a filling. And this is Amy. She's going to be assisting Dr. Stakely today. And there's my favorite person ever right now.
Right now.
So note to all of the patients out there, the best thing that you can do, this is a little pro tip, is be super kind to people that are kind of come at you with local anesthetic. So speaking of local anesthetic, this is not everyone's favorite part of going to the dental office, but there are tips and tricks to make your patients comfortable. So we're going to talk about a couple of those. First thing, topical. Right? Kind of standard. I have had people come at me without using topical, and they were not on my best friends list after that. I don't think you should just come at someone.
And give you weren't sending them a Christmas card, huh?
No. In fact, I never saw them again. So that's how that went down. So this topical, there's a lot of different kinds. What are we using today?
Walter Berry.
Walter Berry.
Walter Berry. Who is Walter? Can someone please answer that for me?
Walter is the best friend of the guy who started Ultradent. I guess it helped him invent Walter Berry.
And they were just best friends?
They were friends. They were.
I need a little side story to that one.
We have to look that one up.
It's a 20% benzo? Is Walter
You
Berry?
ask me these technical questions.
Oh yeah, I'm putting you on the spot now.
It's red. I can tell you that.
So most of you dental pros out there that are watching this, this is not new information, but we do have some consumers that watch this channel as well here on First TV.
I'm on TV now.
Yes.
Okay, I'm going to make you dry for a second, and I'm going to put this up in there for number 12. And we'll just have you keep that there for a moment.
It smells really good. It's my favorite. I've had pina colada. I'm sorry, if I have pina colada, it needs to be in a glass with a straw on the beach. So Walter Berry,
Walter Berry is
that's good, does the trick. So the other thing that you guys do is you adjust the pH on the anesthetic, correct?
what? I'm sorry.
They don't even listen to me.
What that we buffered?
They're doing a little powwow. Yeah, so they've got a buffer that changes the pH of the anesthetic and takes the sting out. So we also, it's been working well.
So
Show us what, oh, she's already mixed it in the back there. And that has to happen chair side right before.
yeah.
Am I getting a MSA or a PSA? Or are we going to
You're
infiltrate?
getting infiltration.
Okay.
We're gonna be filmed this whole.
This is
Yeah, man.
Exciting.
I'm
Okay.
taking one for the team.
Open a little bit. Okay, this is number 12. All you weak need people don't need to watch this then. Okay.
So the reason I wanted you guys to see that is because I've seen that for the past 18 years. The little shaky action, like they actually have instruments that'll vibrate the needle, but I never got good at that. I was just so focused on like, let me make sure I've got my target and all that. But the shaky technique, that's what we're calling it, right? Doesn't hurt at
Distraction.
all, and it's kicking in already.
I'll go ahead and rinse you out.
Don't close your mouth on that completely. It's not gonna feel good. So yeah, we're gonna go, I'm not gonna film this whole thing. I'm gonna get a filling and we'll check in later. But I will say, with all the safety goggles and music and techniques and trends and all that kind of stuff, you know what my favorite thing about local anesthetic is? If it's done right, people just make you feel comfortable. I think that's gonna help your patients more than anything. All right, see you soon. That hat I like, huh?
Ah.
What's that?
We fixed Charlotte so she is somewhat stifled in her ability to speak.
Yeah, I think I'm all young. Right?
Yeah.
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 All right, I'll give you something to rinse out with. No, I'm good. Got Listerine in the bathroom. Thank you, Dr. Stigley.
No spray? You don't want no spray?
Okay, I'll have some spray.
Color product.
Good job.
Good patient.
Just a little bit of anesthetic. I could feel the tissue just a little bit, but I don't feel like I'm going to be numb for 3 days either, so that's good stuff.
We like
He's a pro.
done this before.
Not bad for a second.
All right, so Claire was a longtime patient of mine, and she also loves Dr. Stigley because why?
Absolutely. Well, he has always taken really great care of my teeth. And I've been seeing him now for 10 years.
It's a long time.
Yeah.
That's good. So today I was kind of focusing on local anesthetic because that is not everyone's favorite part of the appointment. In fact, that's the one thing that most people are most nervous about. But some of the strategies that they have here, you know, they've got a anesthetic buffer to bring up the pH so that it doesn't sting quite so much. They use topical anesthetic before they ever come in with the actual needle. But the other thing that I think is so important is that this is a family practice where everybody feels like they are heard and important and valued. And so this segment is to just make a quick point of that. We get so focused on the procedure, insurance, codes, the tools that we're going to use, the instruments and all that kind of stuff, where the thing that they've done right here for so many years is that we pause and we take a minute to get to know patients and build those relationships. I think that's so valuable and something that, you know, no matter where you are in your dental expertise, no matter how amazing you are, if you're just out of school, just getting started, or you've been doing this for 30 years, I think that's one of the most important things is to stop and consider the human being that's sitting in your chair and the relationships that you're building and your ability to make a really dramatic, positive impact for people.
And I do feel that you get that here with Dr. Stakey and all the staff, that we really have established a personal relationship that puts me at ease. So that when I'm here and I'm having a filling, that I'm not overwhelmed and that I have full confidence in their abilities.
Yeah, and then it makes it easy to get past the other parts that are not so great. Like this is, it's a necessary evil, but you don't have to be scared coming in because you know you're in good hands and there's that level of trust. It's so important. So well beyond local anesthetic. But thank you, Claire, so much.
You're
Appreciate your
welcome.
time.